Let's also listen in, meanwhile at the Thai summit, Dipshika Ghosh caught up with the management at Apollo Hospital, Sangita Reddy. Let's listen in.
The day that Modicare was announced, or the aspiration to cover 40% of India's population with a new insurance program, was one of the happiest days that, in my professional life, because I think for the last 35 years we've worked really hard to find ways to bring healthcare within the access of people. And most Indian hospitals provide high quality care at affordable prices, which are 1/10 of global prices. But these prices feel like they're very high because nowhere in the world can anybody afford to pay out of pocket for care. Right. And I know that people, sell their land, they pawn their wife's jewelry for care because we don't have a third party payer system. And so for the last 17 to 20 years, we've been working on, methodologies to cover populations, not individuals. So health insurance is the answer. And Modicare is a large, ambitious scheme which will enable covering of, the lower stratas of the population who today don't have healthcare. Right. Now, the benefits of these are, number one, people will, not have to be pushed into indebtedness or poverty because of healthcare. Right. Number two, insurance is the engine which spurs the development of the healthcare sector. Mm-hmm. So more hospitals will come up, hospitals in rural areas will come up, which will be a good thing because, as you know, our population to bed ratio is really abysmal. Right. The third important thing is this is an opportunity. If we redesign the way insurance is looked at with a holistic focus, with a wellness focus, with a technology enablement, so say the use of blockchain and distributed ledger system, the use of data and compiling of data to create health trends, and then the health departments work on this. Right. This will give us an opportunity which is unprecedented, never available anywhere in the world, leapfrog what's happening, and I predict that India will have the lowest back end per transaction cost compared to any country in the world. Right. If this is done right. Sure. Not only that, I believe that over 340 to 400 million people will get coverage, that a large number of jobs will be generated because healthcare is an employment intensive industry, and most importantly, lives will be saved. I think life expectancy will go up, infant mortality will come down, maternal mortality will come down, and overall, when you have a healthy country, you can have a productive country. Right. So I'm very, very positive about Modicare.
Excellent. So, Sandika, clearly lots of optimism as far as Modicare is concerned. Just to take that thought forward, what would you say is the need of the hour in the healthcare industry as far as accountability goes? Because a problem which comes up over and over again is the accountability in terms of where the funds are going, redirection of healthcare towards the right channel. So, what would you say in terms of policy? Obviously, we have Modicare. Is the need of the hour in terms of healthcare, Sangita?
So I think it's healthcare is a very complex subject. So let me kind of separate. At one level is primary healthcare, which needs focus. It needs investment, it needs partnership. For example, in Andhra, we're doing a fairly unique program of 143 primary healthcare centers are being managed by Apollo. We have the physical management, doctor, nurse, pharmacist, lab technician, and then we have a virtual network. Then we have a data analytics, and we have a reporting accountability. Every 3 minutes we upload data to